Hello students, coming up with our topic that is adverse drug reaction. As in the last class, we have discussing with the basics of adverse drug reaction. We discussed about what is adverse drug reaction, what is adverse drug reaction events, and what are the various classification based on the three topics. So about adverse effect, what I said, adverse effect is the undesirable and the unintended consequence of drug administration. And for adverse drug reaction, what I said, that it is a noxious change which is suspected to be a drug done, occurs at doses normally used in man, requires a treatment or decrease in dose, or indicates a caution in future with the use of same drug. It means what? The noxious effect of drug, so its amount have to be decreased or increased so that to offer a proper medication. So this was the recap of our last class. Now today in the adverse drug reaction, we are going to continue with the two main points, that is prevention of adverse drug reaction, and the second is categorization of adverse drug reactions. Now here, as I said in the contains the 2 points, prevention and categorization. Let's come to this, that in categorization, it is a vast topic. So today I am going to discuss the 5 points of categorization, and in the next class, that is tomorrow, I am going to discuss the next 5 of the categorization of adverse drug effects. So now, first we are going to start with the prevention of adverse drug reaction. Now the first point is, tells us to avoid all inappropriate use of drugs. Often we see in our homes, at many places, people are very ignorant or very careless about taking drugs, and they use it unnecessarily. Like many people, they say, I've got some acidity in my stomach and I'm just taking the Digene. No, that is wrong. If you are feeling acidic stomach, you should have a proper diagnosis of that, or proper diagnosis of that. Why? Because that acidic stomach may be of different reasons, and that acidic stomach may lead to damage to your teeth, your inner lining of mouth, even your inner lining of stomach, and many various places. So, to prevent the adverse drug reaction, this is our first key point, that is to avoid the inappropriate use of drugs. Second is, we should always follow the appropriate dose, route and the frequency of the drug taken. Why? Because the drugs that are being taken by us should show its maximum therapeutic efficacy. If we are using an improper way, such as insulin is best given by intramuscular. So, if we are going to take insulin by oral, the effect will not be that effective. That will be our route. Dose is the quantity. Dose means the dose regimen that we are going to study further in the further use of the drugs. And the frequency, that is the number of times the drugs to be taken, that is Bisindi, Trisindi. This you all have studied in pharmaceutics in your previous semesters. Next is elicit and take into consideration the previous history. That is very important. You need to know the history of the patient as well as the history of the drug reactions, because you never know that what drug or which drug can react with which amount of drug. That is a drug-drug interactions or drug-food interactions. That is a very vital point. Next is the history of allergic diseases, that is the history of the patient. Then the rule out the possibility of drug interactions, that is drug interactions as prescribed, means with the previous prescription, you should need a matching to it. Next is adopt correct drug administration technique. That I said previously, intravenous of vancomycin is slow. Next is, that is cited with one example, then carry out appropriate laboratory monitoring, that is prothrombin time, means When a drug is being administered, in many severe cases, proper monitoring is not being done. In such cases, what happens? Excess of drug or even a disconnection of any device may lead to a severe adverse effect that we can't even get it back. So for that, a very proper and cautious and careful monitoring should be maintained. So these are the 7 points by which we can sustain or we can prevent the adverse drug reaction, or we can prevent the various harmful effects or the noxious effects of the drug reactions. So now coming to the categorization of adverse drug reaction. Now this categorization is being done on the basis of various points, means how these adverse drug reactions are occurring on the basis of what. So first, when I'm going to cite you, then only you can understand that what is the side effect. Now, side effect is the unwanted but often the unavoidable pharmacodynamic effect that occurs at therapeutic doses. Which means what? The dose that we are taking, that is unavoidable. Unavoidable means that drug we have to take. We cannot avoid that drug. But when it is taken as an unwanted and unavoidable, means when it is taken unnecessarily, at that point it is causing a side effect. Next is what? Predicted from the pharmacological profile of a drug. And next is the given percentage of drug recipients, means how the active constituents or how the drug materials are acting or functioning in our body. So these are the key points of the side effects. Now let's see the examples. Examples are very important for your examination. You need to mention the examples, or else the categories of the drugs for adverse drug reaction are not valid. So for each of the categorization you will find many examples and you have to remember that. First is based on the therapeutic effect. You see atropine. What is atropine? Atropine is an anticholinergic drug. On the right hand side of your this presentation you can see atropine is an anticholinergic drug. So here atropine, it causes what? It causes dryness of mouth. So this dryness of mouth, this is its adverse effect. So this is the adverse effect we can see of the atropine. See, you can see this is the adverse effect. Next is acetazolamide. Acetazolamide is this one. So for this acetazolamide, it is a diuretic bicarbonate excretion, means it is used as a anti-diuretic drug, or you can say that it is used as a diuretic drug, means diuresis means it prevents the water loss. Okay. So what happens here? It causes acidosis. Acidosis is the side effect of acetazolamide. Next is the side effect based on different actions. So here is a promethazine. Promethazine is a anti-allergic drug. So here this promethazine is causing what? It is causing sedation. Sedation means which is caused by sedatives and hypnotics, that is causing the sedation. Next is the estrogen. You all know estrogen is what? An anti-ovulatory hormone, or it is a type of hormone. So what it is causing an overuse? It is causing the side effect of nausea. Nausea means vomiting. Now next is depending on the context. Context here we can see, here we have used codeine, which is an antitussive drug, and this codeine is causing what? It is causing constipation or even causing the traveler's diarrhea. So these are the various side effects we can see in case of the categorization of adverse drug reactions. So when a question is coming like what is the categorization of adverse drug reaction based on its side effects, you should cite these examples. This will help to score you good marks. Now this is the next, that is categorization of ADR. The second point is the secondary effects. So for this secondary effect, we can see that indirect consequences of primary action of the drug. Means what? The secondary effects are mainly occurring due to the primary action. So this is the key word. Next, again we are citing examples, that is tetracycline. What is tetracycline? Tetracycline is a type of antibiotics. It is a broad spectrum antibiotic and it is bacteriostatic. And here this note below are very, very important. This is a note below of each of the drugs that are being used has been provided so that you can understand that what is the use of these drugs. Next is superinfections of the corticosteroids that weaken the host defense. That is, a host defense is being decreased, and what happens? The activation of latent tuberculosis. So these are the secondary effects which are causing the adverse drug reactions, and these are the consequences of the primary action of the word. So here the word primary is the key word. Primary is the key word. Primary is the key word. Next, here we are coming to the toxic effects. For this toxic effect, we can see that here we have what? Here we have a toxic effect, the result of the excessive pharmacological action of the drug due to the overuse, overdosage or prolonged use. Means what? Due to overuse of these drugs, we can see that the prolonged use, it is showing a toxic effect. Okay. So here the keyword that we can use is this toxic effect. Toxic effect, and here what is it? It is a pharmacological action, excessive pharmacological action of the drug. This is the excessive pharmacological action of the drug. So this is the highlighting point. Now here we will come down to the overdosage, or maybe overdosage is absolute or relative, and it may result from an extension, that is extension of the therapeutic effect. That we can also write. And here the examples, that is a barbiturates. Barbiturate is a type of sedative hypnotics. Digoxin is a cardiac glycoside. So this is the highlighting point. Here the types of drugs that I have used, that I have highlighted here. So these are the cardiac glycoside, and then the barbiturates, digoxin, heparin. Heparin is a anticoagulant, and the functional alternative, that is the example, that is the atropine, which is causing the delirium. Atropine is a anticholinergic drug, and the drug-induced tissue damage, that is a very common, that is a paracetamol, causes glucuronidation, and it is causing the hepatic necrosis. What is causing? It is causing the hepatic necrosis. So this way we can see that how the categorization of the drugs of the ADR has been done on the basis of two factors. So previously we had done it with side effects. Next we have discussed with secondary effect. Next is the toxic effect. Now the fourth point that we are discussing is the intolerance. So now the categorization of ADR is done on the basis of intolerance. So here in this case, what is being said is that appearance of characteristics toxic effect. So here the word characteristics toxic effect is the key word, which causes what? Converse of tolerance, means the intolerance causing is being highlighted. And next is the, it indicates a low threshold, means low therapeutic effect, or the low benefits has been seen. So these are the three key points. Next we are coming with the drugs. Similarly, like the previous slide, here I have highlighted the various drugs and its uses. So you will see it here. Here it is what? It is a triflupromazine. Triflupromazine is a phenothiazine class of drug. It is an antipsychotic drug. It is causing muscular dystonia. It is causing muscular dystonia. And next is the carbamazepine. Carbamazepine is the anticonvulsant drug. And what it is causing? Ataxia. It is causing ataxia. And next is a chloroquine. You all know chloroquine is a anti-amoebidal, or you can say the most common, that is anti-malarial drug. So you see here, so here we have highlighted the main things, that is the intolerance, the characteristics toxic effect, the converse of a tolerance, then the low threshold, then the dystonias, which is causing due to the triflupromazine, here carbamazepine, which is the anticonvulsant drug, and the chloroquine, which is causing the vomiting. So this way again a categorization of ADR based on the intolerance has been done. So here is a point, that is idiosyncrasy. So in this idiosyncrasy, what we can see is that genetically determined abnormal reactivity of the chemical. So here what is happening? The genetically determined abnormal reactivity of the chemical. Certain bizarre drug effects, as we have discussed in the last, augmented bizarre. So that bizarre drug effects can be seen due to peculiarities of an individual, due to the described or included. And the next is the drug interactions with some unique features and produces the uncharacteristic reaction. So it is causing the uncharacteristic. So this idiosyncrasy is generally determined by the abnormal reactivity of a chemical, or we can vastly say that this idiosyncrasy may be due to the abnormal activity of a chemical, and the drug interacts with some unique feature of the individual not found in majority of the subjects, but producing a uncharacteristic reactions. For example, you can say that barbiturates cause excitation and mental confusion in some individuals. That is what it is saying, that in addition, certain bizarre drug effects are due to the peculiarities of the individual that definite the genotype has been described, with no genotyping has been described, means the genotype has not been described and included in the idiosyncratic characteristic reactions. So here the main thing is that what is idiosyncrasy? Idiosyncrasy is a abnormal reactivity to a chemical. So the unnatural or the uncharacteristic reaction that takes place. Example is the barbiturates, quinine and chloramphenicol. Chloramphenicol is a broad spectrum antibiotic, which is written on the right hand side of here. You can see. So thank you students for listening to the slides. Hope it will help you in write up your assignments, and it will help you in gaining knowledge about the adverse drug reactions, and we will continue with the next points in our next class. Thank you.